Ever thought about what plastic surgery is really like? It's way more than what you see in the movies. It's a serious medical field with two main branches, reconstructive and cosmetic surgery. Let's break it down. First, there is a reconstructive surgery. This is all about restoring function and a normal appearance after some things like an accident, a severe burn, or even cancer treatment. It can also fix conditions someone is born with, like a cleft palate. The technique today are mind blowing. Surgeons use microsurgery to reconnect tiny nerves and blood vessels, and even 3D printing to create custom implants that fit perfectly. It's truly life changing work that helps people regain a sense of normalcy. Then there is a cosmetic surgery, which focuses on enhancing appearance. This includes popular procedures like nose reshaping, also known as rhinoplasty, or treatment to make skin look younger. The trend now is shifting towards less invasive options. Think laser treatment and dermal filler that offer great result with much shorter recovery times. You can often get these done and be back to your routine pretty quickly. But how is a procedure actually done? It's all start with a detailed consultations. You will meet with a qualified surgeon to discuss your goals, your medical history, and what's realistically achievable. They will examine the area, maybe take some photos or use computer imaging to plan the outcome. Safety is always the top priority. Next is preparation. You will have health checks and you might need to stop certain medications. On the day of surgery, the area is cleaned and marked, and you will receive anesthesia to keep you comfortable. For small procedures, it might be local anesthesia where you are awake. But for major surgeries, you will be completely asleep under general anesthesia. The surgery itself varies. In reconstructive surgery, the surgeon might repair damaged tissues, use skin grafts, or perform delicate microsurgery. For cosmetic procedures, they might reshape tissues, use laser to smooth wrinkles, or add volume with implants or fillers. The goal is always a natural look like minimal scarring. Afterwards, incisions are carefully closed and the area is dressed to protect it while it heals. Recovery is a crucial phase. You will need to rest and follow your surgeon instruction closely to manage swelling and discomfort. Follow-up appointments are essential to monitor your healing. And remember, there are also non-surgical options like Botox, fillers, and chemical peels that offer great result without the downtime of surgery. The most important thing to remember is that any procedure should be performed by a certified skilled surgeon. The decision should be about your own health and well-being, not about chasing unrealistic standards. Thanks for watching and don't forget to subscribe for more insights.